A new study out of the UK has revealed even a mild infection from COVID-19's earlier variants could have a significant impact on the parts of your brain responsible for memory and smell. It found COVID can shrink the brain, equivalent to as much as a decade of normal ageing. Karen Rutherford has the details.
Auckland businesswoman Jewel Turinsky has long COVID. The brain fog and fatigue 2 years after infection while visiting the US has been life-changing.
I used to run 3 nonprofits, and after a year after having COVID, I just couldn't do that anymore. I had to give 2 of them up.
And one of the biggest international COVID-19 brain studies backs that up. Completed before Delta and Omicron had even arrived, it's found the earliest variants of COVID slow the brain long-term.
The most significant thing is there are loss of cells, and this loss of cells is a problem.
Researchers compared the brain scans of 401 UK residents aged between 51 and 81 before and after their COVID infection, with around the same number of healthy people. And even the mildest of COVID patients experienced significant changes to the brain.
The regions of the brain that are controlling the smell, that are controlling the memory function. So those regions of the brain has shown they have reduced in size by 6% as compared to the normal healthy brain.
The smell and memory pathways in the brain are connected. Long-term loss of cells is also what affects patients with Alzheimer's and Parkinson's. That's the reality now for our fast-growing Kiwi Facebook community of 400+ long COVID sufferers.
The critical part of all this is that this is not just sort of a slow recovery. This is a disease, that is biological in nature, and we're trying to understand how we can stop that, if you like, or, the treatments to reverse the damage that's been done.
And now hundreds of thousands of Kiwis will be holding out for more research into just how Delta and Omicron affect the brain. Karen Rutherford, Newshub.